the current treatment of multiple sclerosis is still the same as 20 years ago. And stem cells are very good at reducing the overreaction in the immune system that causes the multiple sclerosis. Because it cannot be patented by pharmaceutical companies, they do not want to go that route, even though they know it can be very effective. Hi, Xander. Nice to have you back again.
It's great to be back. I appreciate having me back.
So I heard you were a personal trainer at all around the world. So can you tell me a little bit more about that experience?
Yeah, I had I would say an enlightening experience when I was a personal trainer in Orlando. I worked at a neurological recovery center where I had clients that were in wheelchairs. So they had spinal cord injuries, traumatic brain injuries, multiple sclerosis, Parkinson's disease. And I think a few of them might have mentioned early on, this was like back in 2017, that they knew of stem cell and they never did anything, but like it kind of came to my attention. So that's what, now I'm kind of thinking back on it. That's where I first heard about it. And just from our previous podcast, I could really see them benefiting from the treatments from stem cell. So have you ever worked with anybody, for example, with Parkinson's disease?
Oh, yes. I worked with one guy, and he actually initially went through a clinical trial in Houston. And he felt it may help him reducing the symptoms a little bit, but since it's a clinical trial in the United States, so he didn't get enough quantities in the cells. Because it's important for this kind of condition like Parkinson's or multiple sclerosis, you need to get enough amount of stem cells based on your body weight. So for an adult male, usually you need to get at least 150 million cells in the intravenous infusion to make the treatment effective for this type of more serious neurological conditions. So because he only got around 75 million cells for 2 treatments, and also the treatment are spent I believe like a 2 years period of time. So that may explain why he didn't see significant improvement. So that's why after that, because all the other medications he was on no longer offered him any relief, and his conditions were still progressing. So his doctor basically said there was nothing more they can do. So if you want to try more stem cells, why don't you try that? So that's how I started treating him. And we used 150 million cell infusion plus the intranasal application because in your upper nose area where the olfactory nerve goes to the brain, there's an area, the membrane is very thin, so you don't need to cross the blood-brain barrier for the stem cells to reach the brain. So usually if you do the intranasal application, the stem cells can travel to the brain faster. And the intravenous is still important because it's systemic, but it's fewer amount of cells, stem cells can actually cross the blood-brain barrier. So it's fewer amount of stem cells can actually reach the area in the brain that needs to be treated.
So what did you say? You said intranasal. What exactly is that?
Okay, so basically you lie down with the nose more like your head is like the chin is higher than your the crown of your head. So when we drip the stem cell solution into the nose, it actually goes to the upper part of the nose. Then that's when the stem cell can cross that membrane area where the olfactory nerve connects to the brain. So basically, we do that slowly over maybe 1 hour period of time. So usually you can do that while you're doing the intravenous infusion of the stem cells.
What was this individual that had Parkinson's? What was he like before that? And then what was he like after that?
So before he had a lot of mobility issues, and I cannot even coordinate the hand motion. But then after the 2 treatments we did within the 6 months period of time, then he's able to make the same kind of movement that he couldn't move before. And also he can walk straighter too.
Wow, so like enhanced motor patterns
Yes.
from that standpoint.
So what did you do in the neurological clinic you worked as personal trainer to treat like a spinal injury or multiple sclerosis?
We would oftentimes get like individuals that had high-level spinal cord injuries. We would get them out of the chair, like weight bearing, to assist with their bone density and get movement back to the muscles. And we use a lot of electric stimulation as an example. I'd be very curious to know though, like, would there be any use for like stem cells for individuals that are spinal cord injuries, whether like paraplegic?
That's why I asked you that question.
Yeah.
Because I wonder, like, when you do the training on them, did you also combine with other treatments? Because what you were doing in the neurological clinic, it was more like a physical therapy type of treatment.
Mix both together. So it'd usually be myself and like we'd have a team of like 3 other people. We'd get them out of the chair. So we'd spot them, like whether it's their knees to make sure, because a lot of times if they're a high level spinal cord injury, obviously they don't have any control over their legs. Right. So we'd spot them, hold them. So they're getting gravity, weight bearing. And then we'd also provide stimulation pads attached to different muscle areas. So that it would kind of tap in a little bit when the muscle is moving in a certain exercise.
But what else were they doing to repair the injured spinal cord? Because the reason they couldn't move is because the certain areas of spinal cord was
like detached
or severed or something, right?
Yeah. More so like they would come to like our facility to assist with like the weight bearing element. And a lot of times they don't have insurance able to cover additional avenues of ways to just become a better overall body. So, I mean, there's times I remember like clients talking about some location somewhere in Miami about with stem cells, but this was like early on, so I don't really know much. So I'd be kind of curious from your perspective.
You know, if they already have spinal injury, it's very difficult for the injured part to repair itself.
Right.
So for whatever spinal injury they have, if they combine with stem cell treatment, what it has to be done in the particular location where they have the injury. So for that type of procedure, you have to do the intrathecal injection of stem cell into the exact location where the spinal cord injury happened. So that kind of procedure has to be done in operation room with high sterility because you don't want to have any infection in the spinal cord. So that type of procedure actually also the patient needs to go under anesthesia. But for stem cell, because it's very good at stimulating your own body stem cell to regenerate, and spinal cord injury is very difficult to regenerate. So that's why if you introduce the umbilical cord stem cell in the particular location of injury and then stimulate the regeneration and combining with the weight-bearing exercises you were talking about that you were doing in that clinic, then it can reestablish the transmission from the injured site where the spinal cord injury happened.
Are there other neurological issues that you could see like really benefiting from stem cell therapy?
I've seen stem cell therapy helping multiple sclerosis because it's an autoimmune condition, and stem cells are very good at regulating the immune system and reducing the overreaction in the immune system that causes the multiple sclerosis. Because multiple sclerosis is caused by the immune system attacking your nerve sheath protein that reduces the neurotransmission efficiency. And most multiple sclerosis patients, they are on immunosuppressive drugs to help reduce the inflammation. However, the immunosuppressive drugs, sometimes they don't really work as well. And also you need to keep increasing the dose or switching the drugs. And then eventually, basically right now, the current treatment of multiple sclerosis is still the same as 20 years ago. So they basically just give you the same kind of drug as they gave you 20 years ago, and then they just use MRI to monitor your progression. So for some people, if they modify their lifestyle more, then they may have less progression. And also the progression of multiple sclerosis also depends on each person, depending on their genetic composition. So there are a lot of studies about that we don't need to go into. But basically with stem cell treatment, it really helps regulate the immune system. So for people who have tried multiple different immunosuppressive drugs and then they still have progression, and then using stem cells is a viable alternative option that can slow down the progression of the disease and then help you gain more mobility back.
What would be some of the negative effects for immune suppressive drugs? Like how does that work?
So a lot of immunosuppressive drugs is just generally suppress your immune system. So it doesn't like really specific regulate your own body's immune system so that they do not decrease the ability in defending your body from the external pathogens. That's why a lot of people on immunosuppressive drugs, they are prone to a lot of infections. And also over long term, the immunosuppressive drug actually decreases your whole body's general immune reaction, because your body's immune reaction is important for your body's normal function. Because like in cancer and other type of conditions, if you don't want to develop cancer down the road, you do need your immune system to function correctly. But if you suppress the immune system in general, then you can cause a lot of other things in your body that need to be removed by your immune system, not effectively removed.
And essentially, too, you're eliminating. So, like, if somebody receives stem cell therapy, eliminating that ability that they don't have to be on the immune suppressant subscription, like for longer term kind of thing. So you're removing like an extra cost that would exist in somebody's lifetime. If that makes sense as well.
That's true, but for most people, they still don't think that way at this time. Because stem cell treatment with autoimmune conditions is still new to a lot of people. And then for people with a lot of severe autoimmune conditions, they are still very afraid of exploring outside of the conventional treatments, right, even though they don't get any satisfactory results from it.
Right. I see a lot of times on TV, like commercials, it seems like issues with Crohn's disease, IBS, like digestion issues. Would this be like stem cells? Would that be an avenue to treat that?
So Crohn's, IBS, ulcerative colitis, they are also considered autoimmune because it's your body's immune system attacking your digestive tract. That's why Crohn's disease patients, they would experience flare-ups and then have bloody stool, diarrhea, pain, abdominal pain, and some of them eventually have to go through surgery to remove the part of colon that's very inflamed and cannot be repaired anymore. Then they had to use artificial colon to help compensate the function in the area. Then they have to carry that pouch for the rest of their life. So to reduce all these sufferings from this type of digestive inflammatory conditions, stem cells are very good at reducing inflammation. For these type of inflammatory bowel condition, we use stem cells to regulate the immune system so that they don't attack the digestive tract as they did before, and also can help the patient's overall digestive system, so then they can recover from the previous injury caused by the inflammation and flare-ups. And also for any digestive tract inflammatory conditions, people also need to combine the stem cell treatment with modifying their lifestyle, because a lot of inflammatory bowel conditions are related to stress again.
Self-induced. Yeah, self-induced.
So, because when you have high stress for a long period of time, it also exerts damage to the digestive tract. That's the first area of the system that will affect the stress will act on. So that's why a lot of people, when they have anxiety, they will feel butterfly in the stomach. And then if they feel anxious, then they would have diarrhea. So that's just the body's natural reaction to the stress. If this episode has been valuable for you in any way, please leave a review or a comment. It will really help more people to find reliable, research-based information in a space full of noise.
When it comes to like issues with digestion and you're implementing stem cells, is it just straightforward as like you're injecting like directly into the stomach, or what does that look like? I have no idea.
So for digestive system problems, it's mostly through intravenous injection.
Oh, okay, gotcha. So
because when you go through the vein, then eventually it travels to the lung first, and then it travels to the digestive tract through the vein.
Essentially, so if somebody does stem cell intravenous, got it, thank you. That could solve many different issues, not just tied to obviously because it's the bloodstream. So
because the stem cells, these type of stem cells, mesenchymal stem cells, they have a property that this is already well established in the research that they can travel to the site where you have inflammation. So once you have the stem cells already circulating in your vein, in your bloodstream, they can go anywhere where your body sends signals saying, hey, there's inflammation here, come here to help. Then they will hone in to the area where you have inflammation. And then once they are there, they will start releasing signaling molecules and growth factors to send signals to your own body's cells. And then they will congregate in the area where all the signaling molecules are, and then try to repair and reduce the inflammation on site.
I think that's a very comforting thought for individuals that do want to get stem cell therapy, that it's not like a lot of times, depending on what it is, of course, it's just again attached to go into your blood versus like it has to be something very invasive at times too. So I think that could be a very good thought for individuals thinking about doing stem cell, the way I'm thinking about it.
Exactly,
right now.
because some people, for some advanced neurological conditions like epilepsy, and then there's another there are some other genetic condition with neurological conditions, then there are some biotechnology companies, they're developing implanting induced stem cells into your brain where you have the problem. Like epilepsy, if they know it's from certain area of brain, and then they want to implant that particular induced type stem cell to replace the overacting neurons in your brain that's causing epilepsy. Yeah. But that's very invasive because you have to open up the skull to implant that. But I think I don't have a lot of research about it, but recently I do have several people inquiring about their kids' epilepsy conditions.
Really?
Their children are like teenagers, but they tend to have epilepsy frequently. Like one guy is like having it every month. And they were seeking alternative treatment because it's damaging to the child's lifestyle, and then they cannot function well because of the frequent epilepsy. But the treatment I talked about, like implanting the stem cell into the brain, is more invasive, just like you said.
Right.
So that's why maybe the first step to try is to see whether intravenous and intranasal application of this type of stem cell can help those conditions.
Yeah. Doctor, I'd be very curious, like, so you've been doing stem cells for 4 years. How do you continue like stay sharp with it, or like you continue to do research? Like, is there like a network of other stem cell doctors you are continually like involved with to continually build upon your knowledge as well as sharpen your skill? Like, what does that look like? Like, how are you doing your own research? Let's put it that way.
Okay.
On top of what you're practicing with.
Most of my research I would do online research and then learn about it. And also there are a lot of conferences about stem cells, but a lot of them are still very focused on what I told you about, like they use induced pluripotent stem cells. That's like more a new area people want to develop instead of using umbilical cord stem cells, because for pharmaceutical companies, they would have more control over induced pluripotent stem cells than using umbilical cord stem cells.
I need to take a pause right there. What is pluripotent?
Okay, pluripotent means it can grow into any kind of cells in your body. As long as you give the right condition, they can grow into liver cells, they can grow into kidney cells, it can grow into eye. So they are more like embryonic stem cells, but they are now from embryo, so it's induced. So they can take a piece of your skin and then apply certain condition to make them become pluripotent stem cells. But multipotent, that means they can only differentiate into a limited number of cells. That is what mesenchymal stem cells from the umbilical cord are. They are multipotent, not pluripotent. So because pluripotent stem cells can even grow into tumor because they can grow into any kind of cells. But multipotent cell, because they can only differentiate into, say, mesenchymal stem cell can only differentiate into bone, cartilage, skin, neurons, then they won't grow into tumor cells because they're limited to the type of cells they can differentiate it into. So the reason pharmaceutical companies, they're interested in induced pluripotent cells is because they have more control and they can patent it as a drug because it's induced, and then they have their special method to induce it. But for multipotent mesenchymal stem cell from umbilical cord, because you can get it from umbilical cord, and the batch you get from the umbilical cord is actually not a single type of mesenchymal stem cell. It's now monoclonal. That means it's now from the same ancestor. It actually can be a variety of different types of mesenchymal stem cells. So it's very difficult to standardize this type of stem cells. That's why it's not very popular to pharmaceutical companies, because it's very difficult for them to say this is their patented treatment.
Mass marketed,
Yes.
When it goes back to control. But do you see, like, going forward, you say that might be an issue, I guess maybe for yourself and just how you communicate your message about stem cells, because maybe now stem cells being provided by pharmaceutical companies, like, is that something that they could come up later down the line of development of just the treatment of stem cells in general? Like,
I mean, the treatment are already there, but the problem is because it cannot be patented by pharmaceutical companies, then they do not want to go that route, even though they know it can be very effective for a lot of different conditions. That's why right now the accessibility of this type of treatment is limited in the United States.
I've also heard too that people are getting their own stem cells in other parts of, I guess, maybe certain sections of the States. Do you know anything about that? Like, what does that look like?
There are two different types of stem cell treatment available now, either autologous or allogenic. So autologous means it's obtained from your own body. So the mesenchymal stem cells that can be obtained from your own body is either from bone marrow or from fatty tissue. So they can do liposuction on your belly and then extract the stem cells from the fatty tissue they got from your belly. So it's possible to obtain your own body stem cells. And then once you concentrate them, you can re-inject them into your joint or other places. But the problem with the autologous treatment is that for somebody in their 40s or even older, their own stem cells also decline when they age. Just like we talked about that when you were young, the stem cells one can divide into 1 billion cells in 30 days. And then once you reach age 60, it can only divide into 40,000 cells in 30 days. So it's a significant decline. And if you use the same kind of aged stem cell to treat an aging person, it's not effective because you're not injecting any new life into the aging person to slow down the aging. I would not say it's not like totally ineffective. For some people, it did work for them for certain conditions. But if you really want to treat very advanced conditions like Parkinson's, multiple sclerosis, or even just very severe osteoarthritis of the knees, I know people who have already got autologous treatment in the United States. They say their effect are not very satisfactory. And some of them, they actually, because of that, they think stem cells is not that treatment option for them, even though they don't know. There's another type, which is allogenic, which is you use the umbilical cord stem cell that are very young. One cell can divide into 1 billion cells. Also, they have all the new growth hormones and cell signaling molecules from the newborn baby. And also there's a research paper published. If you grow the umbilical cord stem cells with the autologous stem cell from a 60-year-old patient together for 3 generations, the stem cells from the 60-year-old patient actually can become young again because it's in the environment of the newborn stem cell environment. So the stem cell can become young again, but then you have to grow them outside of the body for 3 generations. Wow. So that means it's possible if you want to use autologous stem cells, you have to do that procedure. Then you reintroduce your own stem cell into your body. Then they can act as if they're young.
Wow. But you have to wait 3 generations.
Yes.
So it's like, is that 60 years?
No, 3 generations means like you grow the cells in the lab 3 generations. So it doesn't take 60 years to grow 3 It actually usually takes 1 week to grow 1 generation. So 3 generations, 3 weeks.
But also, are there times if you are doing your own stem cells, like you're taking out your own cells with the purpose of putting it back in? Are there times that could also be painful? Like if you're doing bone marrow, like it's...
Yes, so it's a very invasive procedure and you have to go under general anesthesia because they have to go through your bone marrow.
So why would somebody even want to do that then? Like it sounds like...
Because this is the only type of stem cell treatment approved by FDA in the US. So for people who don't want to go outside of the US to receive young stem cells, and also people... I don't know. For some people, they're in their mind, FDA approval is the golden standard for them. They don't trust anything beyond FDA approval, but that's another topic.
Dr. Yu, this has been, again, like a wealth of information for me. Can you please just mention your contact information again, like how people can get in touch with you and learn more about stem cells and possibly work with you?
Sure. So you can visit stemcelltherapyexperts.com and we will have a lot of commonly asked questions and also explaining different conditions that may relate to you or your loved ones. And we're looking forward to helping more people have gained their health control back and also have their health back when they age.
Yeah. And where are you based at right now? Like where you do your therapy?
For this type of treatment, we do it in Colombia. But for the consultation and other parts, we can certainly do it in the United States.
Awesome. No, thank you again for
thank you for
wisdom on stem cells.
Yeah, thank you for asking all these valuable questions so that we can educate more people.
Yeah, looking forward to it.